Good morning, everybody. We are joined today by United Healthcare to go over their 2025-2026 product updates. If you have a question, please type it in the question box. We will answer at the end of the presentation. Just a little housekeeping before we get started. A reminder, if you have any questions throughout the presentation, you can type them in the question box and we'll address them during the Q&A at the end of the show. You can connect with us on social media and subscribe to our weekly Monday Minute newsletter. Here's my contact information if anybody needs it. And now I'm going to pass it over to United Healthcare. Take it away, guys.
Great. Thanks, everybody, for joining. My name's Ed Lightcap. I'm the small group sales rep in the Cleveland market of Ohio. We have a number of people here today at United about to go over small group information. I'm going to kick it off. Mike, you can go to the next slide. Our primary focus of this meeting is going to be our MEWA product. That is our lead product in the state of Ohio for small business. So we're kind of just going to review that. The nice thing is this ain't going to be a meeting where we're heavily talking about things that we're changing for 2026. As you may be used to us doing every year, changing things, we've made minimum changes this year to our program and plan designs. So we're just continuing as normal. Things that differentiate our MEWA compared to our competitors out there is the main one is we have a health engagement nurse. So we have a nurse that's dedicated to the entire population of the MEWA that's just there to help control cost. We're going to go over a little bit more of that a little bit later, so I'm not going to steal anybody's thunder. Another thing is we have a national network. So for those that have done business with us for a while, we use our National Choice Plus network with our MEWA, which is our largest national network. So just know that when people move to United Healthcare, there's usually minimum network disruption at all. Give you an example. We have every single hospital contracted in the state of Ohio on our Choice Plus network, so extremely large. Another thing is we're simple. A big thing once COVID hit was how do we become easier to work with for small business, both from getting quotes to you guys in quoting groups and also installing groups. And we made some extreme progress on that I'll talk about a little bit later. We're going to go over some value adds later as well, so I'm not going to get into all those. And then lastly, we do COBRA administration. So one thing that's unique about the MEWA is that everybody is COBRA eligible, and part of that benefit then is since we know all groups are COBRA eligible, we will do the administration for that at no cost at all for members in our groups. Next, please, Mike. Now, I mentioned earlier about how we're becoming easier to work with. So, after COVID hit, there wasn't a lot of small groups that seemed to be quoting that much, and it doesn't seem like too many people like to do apps anymore. We always hear negative comments about FormFire. So we try to think of ways to make it easier, and we came back with member-level census underwriting. So this is where, as long as a group has 5 or more enrolled employees in medical and they have current coverage, we don't need applications to underwrite a group. All we need is a member level census that has things like first and last name, gender, date of birth, and home zip. That's the only information we need for every enrolling member on the group. So when I say member, I'm using that word to, denote both employees, spouses, and children. We need to underwrite everybody that's enrolling. But again, this makes it extremely easy to underwrite groups. And one thing I'm going to really suggest here is to let everybody know, we underwrite a group how you submit the group to us. And what that really means is that if you submit FormFire applications to us, we're going to use those applications and underwrite the group. If the group qualifies for member level census underwriting, which most do, and you just send us a census, we're going to underwrite it that way. And the reason why that's important is because we will finish the group how we started. So if you submitted the member level census to quote the group, we will install the group with a census as well. And that way, when census changes occur, which they always do in small business, you don't need to go out and have people refill out applications. That seems to be, the things that slow down installs the most that I see is that, hey, we're going to sell a group, there's some census changes. Sometimes it's not so easy to get those census changes to complete apps. You don't need to worry about with the census. So again, please take advantage of this. Another thing we've done behind the scenes is increase our installation unit with the MEWA. In the last maybe year and a half, we've been running faster than I ever thought was possible at United Healthcare, and I've been here a while. Usually groups are getting installed extremely quickly, in addition to being able to provide quotes very easily with a member level census. So again, one thing that we ask is to quote your groups with us. Do a market check to see how we are compared to the renewal. And that way you can see, hey, how does a market looking compared to the renewal? Do we need to shop further and have apps filled out so we can market other carriers? So please take advantage of this. It's extremely easy. Contact your AE if you have any questions on this. But we've been doing it for a couple of years now, and it's been going extremely well. And a lot of the groups that we sell are on member level censuses. So when people, ask me, hey, Ed, what's your most competitive industry or this, I'll tell you, it's really people that are doing the member level census seem to move easier because they know that, there's not applications that need to be updated if changes occur. Next. Another thing that we've done is we have a very small portfolio of plans. Okay. So for those that have done business with us for a long time, we've always had too many plan designs, bad plan codes, and people really didn't know what to sell. And we decided a couple years ago, let's really make a smaller portfolio that people understand the plans. There's not so many where you don't know what to sell. So we really only have a plan right now, a portfolio of plans in the MEWA that's 11 plans. 8 are performance plans, which are just PPO plans, and 3 are high deductible HSAs. Couple other things that we've done over the years, just to make sure you're aware, is, there's a broad pharmacy network. So in the past, we would exclude CVSs from the network. We've moved on from that, and everybody's included in our pharmacy network. And then just to let you know, in addition to that, the essential PDL is a preferred drug list that we have with our MEWA plan. Okay. The one thing I really just want to point out too, and we have it highlighted here, virtual visits for HSAs, there is a cost share for that. We don't want to have one, but the way the rules are with the IRS is that we actually had to make those HSAs have a cost share this year. So we just wanted to make sure everybody's aware of that. If you do take one of the performance plans, the PPO plans, it's covered at a $0 cost for virtual visits. So one thing that we kind of recommend is, HSAs seem to be popular with high net worth individuals and owners, but they're plans that really have low satisfaction rates. We encourage you to look at our performance plans or PPO plans because they're not that price different from our HSA plans, because those HSA plans typically don't perform as well and usually have the people that don't understand the plans the most are the HSAs. So one thing I do want to point out, it doesn't say it on here, is that we commonly get the question is how many plan designs can I sell with the MEWA? You can offer as many as you want. There's technically 11 plans. If you want to offer all 11 to the group, you technically can. We can install groups with no membership if you let us know up front when we sell it. So we just want to make sure that everybody's aware that we can sell multiple options. Okay, I think that's it for my presentation of the slides. Next, I'm going to be passing it off to Colleen Renner to be talking about the value adds that we have with our MEWA. Thank you, everybody.
Right. Thank you, Ed. And a reminder just from Ed's piece there, we are quoting 1-1 now. So quote your groups for 1-1. Like Ed said, the census underwriting is the easiest. So appreciate your partnership with that one there. But my name's Colleen Renner. I am the Director of New Business and Existing Business for 2 to 50 across the entire state of Ohio. So where Ed's up there in Cleveland, I sit here in Columbus and work with you guys all across the entire state of Ohio. I'm going to go through some of our value adds. These are things that aren't new, but they are reminders, differentiators that we want to make sure that you're up to date on and just give you a reminder on. So Mike, if you can go to the next slide. The first one Ed had already touched on as well, but this is Michelle Adams. She is our health engagement nurse. So she is specific to the MEWA population. She only works with the MEWA population, and she's very unique for a 2 to 50 space. This type of role is typically seen in a large key account group where they work directly with the members. Michelle does the same thing, but works with a wide variety of groups and the members here. So she does not only helping groups on a understanding of all of their benefits. She will reach out to them usually about 2 to 3 months after a new group is coming on. She'll reach out to the group, send out information, make sure they're aware of all of the different value adds that we have. Also help connect them for any kind of questions they have as well to our service teams. She sends out a lot of information on education. So you might have seen things that are posted on the Chamber LinkedIn. You might have seen newsletters coming out of the Chamber that have our United Healthcare tools and resources. She supports those. And then she also does a lot of engagement with our members to make sure that they're getting the right care at the right place. So those frequent flyers to the emergency room, she will reach out to them, make sure they're aware that they have urgent care, make sure they have a PCP. Those that haven't gotten a screening, breast cancer screening, now that we're moving into October, you'll see a lot about that. She'll reach out to those members and make sure that they're aware and be able to get those screenings. Usually they get a wide variety of other screenings as well. So helps give support, helps them be able to utilize and navigate the healthcare system as well. She does reach out to your group, so just be aware that she exists. She is always available to help groups be able to navigate and understand their benefits. She's willing to do virtual meetings as well with groups as well. So just be aware that she is there to help manage our total cost of care. And Mike, if you go to the next slide, a couple of the value adds that we have here. So the first one is about a year old, is what's called level 2. Again, this is something that usually you see in our key account space, but we've taken it down to the MEWA. It is specifically for type 2 diabetes. So Mike, if you can go to the next slide. What this program is those that are diagnosed with type 2 diabetes, meaning somewhere in their claims they have type 2, the level 2 program will reach out to them to engage with them. The benefits of this program is not only do you have the whole care team that's shown here on the slide, from dietitians to coaches to nurses to providers that work with their local PCP, but you also have access to those continuous glucose monitors. Those things can take hoops to jump through in order to get. There's a lot of prior authorizations. They can be very costly. This program assists them getting those at no cost very easily, and then supports them through understanding how to utilize them, understanding what different tweaks in their day, their diet, their activities might do to their glucose levels. The goal of this program is to help members go into remission on type 2 diabetes. It's to help them live a healthier life, help them better manage their type 2 diabetes. Type 2 diabetics will get information sent to them on this, but Michelle can also give them information and refer them into the program. So know that if you have somebody coming on the plan that is a type 2 diabetic, make sure they're aware of this program and that Michelle can help them get into the program as well. One thing that she usually calls out is that there is a registered dietitian here. A lot of individuals will be diagnosed with type 2 something like 10 years ago. They might have talked to a dietitian then, but our bodies change, we change. And so that dietitian is somebody that's helpful to help them understand what's going on, what best to eat, etc. So know that this is a program available for those type 2 diabetics. Next slide. Vital drugs is something that you see across all of our plans in ACA level funded and the MEWA. This is a program that we rolled out a few years back, and the goal of this program is to make sure that members can get access to drugs that are something that keeps them alive. Vital drugs, hence the name. So a whole wide variety of drugs. The biggest one that has the most impact is insulins, not only with those vials, but also giving them the pens as well. It's a $0 benefit for them. This is on not only the HSA, but also the PPO. So not only covering those insulins, but also EpiPens, asthma, the hypoglycemia, and then also opioids, making sure that people have access to the drugs that they need at a $0 copay there. So again, it's to make sure that people don't have to choose between rent, food, drugs, making sure that they have access to it at $0. And again, built into all of our 2 to 50 plans. And then the last program that we want to remind you on is the UHC rewards. So on the MEWA, this is automatically built in. Those of you that remember when we used to have the motion program, this is the next step of the program. On our PPO plans, they're automatically built with a core program that is a $300 annual incentive. And on the HSA plan, similar to the old motion program, they're automatically built with the $1,000 maximum annual incentive. So with this program, you register at myuhc.com for it, and you utilize the MyUHC app as well. But you can see there's a wide variety of programs that you can choose to engage in. We highly recommend that you encourage your groups to engage with this. If they don't want to connect a tracker, that's fine, but note that there's things like complete a health survey, get a biometric screening, get a flu shot, get an annual checkup. Those are things that they're most likely doing, and they should be doing, that they will automatically get paid for. So on the PPO plan, it's a $0 virtual visit. If they have their MyUHC connected with the rewards program, they would get $10 essentially paid for a virtual visit. So encourage your groups and your members to sign up for it, register for myuhc.com, and utilize this program. On the PPO plan, you would be able to earn those dollars and get paid out via a Visa gift card. And on the HSA, you can utilize an HSA bank, be it Optum or an outside bank, or you could utilize those Visa gift cards as well. Great program. Reach out to your AEs if you have any questions on that or any of the other wellness programs. But at this point, I'll turn it over to Mike to walk through grandmother and grandfather groups.
Perfect. Thank you, Colleen, and good morning, everyone. For those who don't know me, my name is Mike Payton. I'm a UHC AE located here in Cincinnati. I've got my Cincinnati Reds polo shirt on today, so hopefully they do well tonight. But my territory is the Cincinnati and Dayton market. And I'm going to kick things off here by reviewing the grandmother and grandfather groups. So if you remember 1/1 of 25, UHC actually launched a bonus program for the state of Ohio. If you have a client today that's in a grandmother or grandfather group or program today with a competitor of ours, so that means that they have not moved since 2014. UHC is actually extending that program through 1/1/26. You've got till the end of January of 26 to submit groups for 1/1/26. But the way the program works is if you have a group, it doesn't matter if it's a 2-member group or a 50-member group. Just remember, though, if you've got a group with 5 or more enrolled employees and they are in a grandmother-grandfather group today, all we request is a copy of their grandmother-grandfather renewal and also a member-level census, and we can actually provide you with a underwritten quote. For those groups that are on the smaller end, between 2 and 4, we just need applications and also a copy of their grandmother-grandfather renewal. The reason why I asked for the renewal is we can actually tag it. So if the case were to sell, the broker will receive a one-time payout of $150 per enrolled employee on the MEWA. So again, this is only for Ohio groups, and it's for the grandmother-grandfathered. And if you have groups today, it doesn't matter if they've received a 0% renewal or a 20% renewal or 40% renewal. We just ask that you shop those groups, check the rates. There's a very good opportunity that the UHC rates will come in below what they're paying today. I know over the past year, we've taken over a lot of these groups internally, so hopefully you guys can take advantage of them for 1/1/26. Now I'm going to review a few things when it comes to specialty. So when it comes to bundling discounts, here in the state of Ohio with the MEWA, we do offer something called Activate the Savings. And so if you were to move, the way the program works is if you have a dental product that has 10 or more enrolled employees, and you also add one more line of coverage that includes 10 or more enrolled employees. So that can be vision, base life, for example. So if you have a group of 10 or more enrolled employees in a dental, 10 or more enrolled employees on another line of coverage, we're going to provide the group with a one-time payout of $50 per subscriber that's enrolled in the dental. So that's the bundling program we have for 1/1/20 or through 1/1/26 right now. It's called Activated Savings. When it comes to quoting, On the MEWA quotes, we do include a base life, dental, and vision quote. My recommendation would be to, if we are competitive on the MEWA quote, is to reach out to your UHC AE and let us actually run a quote for you. We just want to make sure that we have all the eligible employees on the quote so the rates don't change. UHC Dental and Vision, we quote based on number of eligible and not who enrolls into the coverage. So just make sure you reach out to your AE. We can actually match the current plan designs, we can enhance them, and we also have special discounts on our end that we can apply to the rates to help offset the cost. So again, please reach out to your UHC AE and we can assist you with an opportunity when it comes to specialty. So when it comes to UHC specialty, I know every year we always go over saying, yeah, we've got base life. We do offer base life, dental, vision, voluntary life, short-term, long-term disability. But when it comes to dental and vision, today I want to go through just a couple more enhanced benefits that UHC does offer, and just some ways as to why UHC is different than the market. So what's nice about UHC is that we've got over 25 million members today, 30 plus years of experience, and over 120,000 unique providers. We do offer a contributory or voluntary quote or funding when it comes to funding arrangements. So if you want a voluntary quote, that means that the employer is contributing anywhere between 0% and 49%. For contributory quotes, we can actually get a little bit more competitive that way. That means that the employer is contributing between 50% and 100%. Participation for contributory is 75% or more. When it comes to voluntary, we require a minimum of 2 employees to enroll, and also goes down to 2 eligible. When it comes to ortho, we do have plans but we do require 5 or more eligible employees with a minimum of 3 enrolling. We can offer a dual option with 10 or more enrolling. But when it comes to dental, I'm sure you've all seen it in the market today where just like everything else in this world is the rates keep going up. I was on a call a couple months ago and found out that there's actually a shortage when it comes to dental hygienists. And so the reason why I feel like not only UHC, but just the block in general, even my competitors, the rates are going up because the fee schedules are just obviously going up as well. The dentists have to pay a little more to keep their high qualified hygienists and whatnot. And so they've increased the cost, which means that dental costs have gone up over the years. But what's nice about UHC Dental is that we do offer a 12-month rate guarantee. And then in addition to the 12-month rate guarantee, we actually offer a 5% second year renewal rate cap. So again, we'll provide you with a 12-month rate guarantee, and then in year 2, we do provide you with a 5% rate cap on year 2. We do offer child and adult ortho for groups, again, with 5 or more enrolled employees. And also when it comes to value adds, please make sure you review the quote and also talk to your AE when I talk about these too. But we do offer a consumer max multiplier and also a preventative max multiplier. When it comes to the consumer max multiplier, what that means to you, I'm sure everyone knows, it's actually that rollover benefit. So I know my competitors do, some competitors do offer a rollover benefit. We do have the ability to quote it or also remove it. If we remove it, obviously it reduces the rates a little bit, but what's nice about UHC's rollover is that we can include it on the quotes for a very small increase to the rates. Typically, a lot of the quotes we do provide do include this, just so everyone's aware of how this works. So if you have $1,000 max, for example, and let's say an employee uses at least $500 of the max or less, we'll provide that employee with a $250 rollover benefit. So next year they'll have a $1,250 annual max. And also, if they do visit an in-network dentist, we'll provide you with additional $100. So that employee can receive a $1,350 maximum next year if they have claims less than $500, and also go to an in-network dentist. So again, every maximum has their own threshold, but for $1,000 max, anything less than $500, you can have that rollover benefit. Also, when it comes to the preventative max multiplier, what that means is that if you have a dental plan and you include this, or we add this onto this added value benefit to the quote, what that means is that your preventative cleanings, for example, let's say you've got a $1,000 max and the cleaning was $200. If you have the preventative max multiplier on the actual quote, that means that the preventative services don't count towards the annual max. So if you have a cleaning done as $200, you still have that full $1,000 max throughout the year. We do offer annual maxes as low as $500 up to unlimited maximums. We do offer an enhanced pregnancy benefit. And also one thing I want to talk about is called teledentistry. I don't recommend this for employees or members to utilize a teledentistry to have, for their 2 cleanings per year, for example, right? One example I want to give to you as to why teledentistry is important and why it's different of some that UHC offers that others may not. So about 5 years ago, I'll never forget, my wife and I were in Chicago visiting some family, and my wife actually had a toothache, and it was probably the most miserable weekend of all time because she was laying in bed all weekend with a bad toothache. What's nice about teledentistry is that, with us being out of town, our dentist is not available. You can actually have a virtual visit with with an online dentist, and they can actually maybe prescribe you with an antibiotic that may help, kill the infection, and then also give you a few more days until you get back in town to visit your doctor or your dentist to have that service done. So again, keep in mind, teledentistry is a nice little service that UHC does offer when it comes to our plans, and also we do include an oral cancer screening. When it comes to UHC vision, I actually really like our vision. It's very unique. We've got over 50 years of experience today, 27 million members we serve. Again, we do offer a contrib or voluntary plan. So contributory, 75% participation. Voluntary, which means that the employer is contributing anywhere between 0% and 49%. We actually go down to 1 enrolled. So the dental goes down to 2 enrolled, and the vision, we actually just require 1 to enroll with a minimum 2 eligible. We do include a maternity and pediatric benefit as well. But a couple add-ons that you may not know is that we do offer a laser vision correction discount, so up to 35% or more off of LASIK locations. We do offer a blue light screen protector, so you can get up to 30% off screen protectors for electronic devices. We have a hearing aid discount. When it comes to hearing aids, it's typically not the device that's actually expensive. It's actually the batteries that go into the hearing aids. So we do offer a savings on the actual hearing aids as well. And then also we do include something called express exam. So going back to the dental, when it comes to teledentistry, when it comes to vision, it's something that's very similar, but I just don't recommend it unless you're in a pinch. So the way express exam works is that if you were to, let's say you're getting close to your 1-year mark, and you go in your closet and you find out that you've got 3 days of contact lenses left and available, so you're kind of in a pinch. What you can actually do is that we partner with 1-800-CONTACTS. You can actually do a virtual eye doctor visit. And so what's nice about that is that they can actually renew your prescription, so you don't have to worry about wearing your glasses until you go back to the actual eye doctor. So something to keep in mind is that we do include a express exam virtual visit. I don't recommend it for employees. It's always good to go to the actual doctor or go to your vision provider, so they can actually manually check your eyes on the spot. But what's nice about the express exam virtual visits is that you can actually, get a pair of contacts or glasses, for example, if you're in a pinch. And we also do have members do have access to something called Benefit Hub. It's a site that has over 200 discounts and rewards for nutrition, memberships, restaurant, travel, and more. So these are just some value adds that you may not know when it comes to dental and vision. So hopefully in the 4th quarter, when you do plan on quoting your dental and vision, these are just some ways that you can actually recommend UHC over one of our competitors. So with that being said, I'm going to kick it back over to Colleen, and she's going to talk about UHC renewals. So Colleen, it's all you.
Yeah, so I'll wrap us up here. Just want to make sure we go through some of the renewal updates. As you all know, UHC Services is our site where you can find a wide variety of everything. So documents, marketing materials, you can do all of your billing and process enrollment changes out there. All of the benefit summaries are posted out there as well. But from a renewal perspective, our renewal packets are automatically posted 60 to 90 days prior to the renewal. On the MEWA, they are automatically posted. They are expected to be posted around October 7th. You'll get notification if you have any level funded groups as well once those are posted. I do want to call it as well that you might see a quote for a group that is on a different platform. Those are things that we will offer to make sure that you see other opportunities that might be a good fit for your client. So depending on their census, their claims experience, it might make more sense if they're currently on a fully insured group to be offered a MEWA quote. If they're in Indiana, Kentucky, currently on fully insured, so that they'll see a level funded group and vice versa as well. So know that they are not being moved to those new plans. It is simply a quote to make sure that they're seeing those other opportunities. And if it makes sense for the group, that you can easily move them there. Last reminder as we go into 1-1 here is your service support. So you have both CSOs and DCSMs. They're there for your day-to-day issues, like I need to enroll somebody, I have a claims issue, I have a billing issue. Reach out to them. However, we all know that we have those groups where you bang your head against the wall, things just don't seem to go smoothly. You have a member in the moment, usually it's an owner's son or something like that, standing in the pharmacy on a Friday afternoon. Know that we have our field account manager, Terry Todd. She sits in Cincinnati. She is available to support and escalate any kind of issues as well. All of your AEs are also able to escalate to her and to myself as well, but want to make sure that you're aware of what other support options that you have. And with that, we'll open it up for any remaining questions, or Becky, I'm not sure if you're taking back over here.
We do have one question. They want to know if we'll be able to get a copy of the slides.
Yeah, we can send out a copy of the slides.
Okay, and I think that's it. Oh, here's another one. Does the renewal increase from the incumbent carrier have to be below a certain percentage in order to get underwritten quotes from a member level census? No.
We do not, no. And also, just to call out too, you do not need to have the renewal in order to get a quote. I'll speak on behalf of all of our AEs. They want to see if it's something that makes sense, is competitive, so they want to see the renewal. However, in order to get a quote, no, you do not need to have it under a certain percentage. As well as also from a grandfathered perspective, last year we did require that it was 10 plus or better than 10% renewal. We don't have those requirements this year, so just send it in normal and we'll be able to evaluate and tag those for bonus as well.
Okay. The January renewals should be available on, you said the 7th?
After the 7th, correct.
Okay. I'm not sure, Jill, on your question about if we're going to do an over 50 webinar. Probably not. That is all the questions I see. So I think we're good. Thank you guys for joining us today.
Thanks everyone for your time and look forward to a fun and successful fourth quarter.
All right, sounds good. Thank
Thank
you.
you all.